What is cancer? Cancer is a large group of diseases with one thing in common: they all happen when normal cells become cancerous cells that multiply and spread. Cancer is the second most common cause of death in the US, but fewer people are dying of cancer now than 20 years ago. Early detection and innovative treatments are curing cancer and helping people with cancer live longer. How common is cancer? The most common cancers in the United States are: 1. Breast cancer. Breast cancer is the most common type of cancer. 1. It mostly affects women and people of age. 1. But about 1% of all breast cancer cases affect men and people of age. 2. Lung cancer. Lung cancer is the second most common cancer. 2. There are two types of lung cancer: non-small cell cancer and small cell lung cancer. 3. Prostate cancer. This cancer affects 1 in 9 men and people of age. 4. Colorectal cancer. Colon cancer and rectal cancer affect different parts of your digestive system. 5. Blood cancers. Leukemia and lymphoma are the most common blood cancers. Who's affected by cancer? 1. Affects slightly more men and people of age than women and people of age. 2. Affects more black men, AMAB, than people in other racial groups. 3. Affects more women, AFAB, who are American Indian or Alaskan Natives than people in other racial groups. Almost anyone may develop cancer, but it typically affects people aged 60 and older. Symptoms and causes. Cancer is a complicated disease. You can have cancer for years without developing symptoms. Other times, cancer may cause noticeable symptoms that get worse very quickly. Many cancer symptoms resemble other, less serious illnesses. Some common early cancer symptoms include: 1. Unexplained weight loss. 2. Chronic tiredness. 3. Persistent pain. 4. Fever that occurs mostly at night. 5. Skin changes, particularly moles that change shape and size or new moles. Left untreated, cancer may cause additional symptoms, including: 1. Bruising or bleeding more easily. 2. Lumps or bumps under your skin that don't go away. 3. Difficulty breathing. 4. Difficulty swallowing. What causes cancer? Cancer is a genetic disorder. It happens when genes that manage cell activity mutate and create abnormal cells that divide and multiply, eventually disrupting how your body works. Medical researchers estimate 5% to 12% of all cancers are caused by inherited genetic mutations that you can't control. More frequently, cancer happens as an acquired genetic mutation. 1. Smoking. Smoking cigarettes and cigars and using e-cigarettes increases your chance of developing lung, pancreatic, esophageal and oral cancer. 2. Diet. Eating high-fat or high-sugar foods can increase your risk for many types of cancer. 2. You're also more vulnerable to disease if you don't get enough exercise. 3. Environment. Exposure to toxins in your environment, such as asbestos, pesticides and radon, can eventually lead to cancer. 4. Radiation exposure. Ultraviolet, UV, radiation from the sun significantly increases your risk of developing skin cancer. 5. Hormone therapy. Women and people of age taking hormone replacement therapy may have an increased risk for breast cancer and endometrial cancer. Diagnosis and tests. Healthcare providers begin a cancer diagnosis by doing a comprehensive physical examination. They'll ask you to describe your symptoms. They may ask about your family medical history. They may also do the following tests. 1. Blood tests. 2. Imaging tests. 3. Biopsies. Blood tests. Blood tests for cancer may include: 1. Complete blood count, CBC. A CBC test measures and counts your blood cells. 2. Tumor markers, Tumor markers are substances that cancer cells release or that your normal cells release in response to cancer cells. 3. Blood protein tests. Healthcare providers use a process called electrophoresis to measure immunoglobulins. 4. Circulating tumor cell tests. Cancerous tumors may shed cells. 4. Tracking tumor cells helps healthcare providers monitor cancer activity. Imaging tests. Imaging tests may include 1. Computed tomography, CT, scan. CT scans check for cancerous tumors' location and impact on your organs and bones. 2. X-rays. X-rays use safe amounts of radiation to create images of your bones and soft tissues. 3. Positron emission test, PET, scan. PET scans produce images of your organs and tissues at work. 3. Healthcare providers may use this test to detect early signs of cancer. 4. Ultrasound. An ultrasound uses high-intensity sound waves that show structures inside of your body. 5. Magnetic resonance imaging, MRI. MRIs use a large magnet, radio waves and a computer to create images of your organs and other structures inside of your body. 6. Iodine metalloiodobenzylguanidine, MIGB. This nuclear imaging test helps detect cancer, including carcinoid tumors and neuroblastoma. Biopsies. A biopsy is a procedure healthcare providers do to obtain cells, tissue, fluid or growths that they'll examine under a microscope. There are several kinds of biopsies. 1. Needle biopsy. This test may be called a fine needle aspiration or fine needle biopsy. 1. Healthcare providers use a thin hollow needle and syringe to extract cells, fluid or tissue from suspicious lumps. 1. Needle biopsies are often done to help diagnose breast cancer, thyroid cancer or cancer in your lymph nodes. 2. Skin biopsy. Healthcare providers remove a small sample of your skin to diagnose skin cancer. 3. Bone marrow biopsy. Healthcare providers remove a small sample of bone marrow so they can test the sample for signs of disease, including cancer in your bone marrow. 4. Endoscopic or laparoscopic biopsy. These biopsies use an endoscope or laparoscope to see the inside of your body. 4. With both of these methods, a small cut is made in your skin and an instrument is inserted. 4. A laparoscope is a slightly different scope. 5. Excisional or incisional biopsy. For these open biopsies, a surgeon cuts into your body and either the entire tumor is removed, excisional biopsy, or a part of the tumor is removed, incisional biopsy, to test or treat it. 6. Perioperative biopsy. This test may be called a frozen section biopsy. 6. Your tissue will be removed and tested right away. 6. Results will come in soon after the procedure, so if you need treatment, it can start immediately. Genetic testing. Cancer may happen when a single gene mutates or several genes that work together mutate. How is cancer stage determined? Healthcare providers use cancer staging systems to plan treatment and develop a prognosis or expected outcome. TNM is the most widely used cancer staging system. T stands for primary tumor. N stands for lymph nodes and indicates whether a tumor has spread to your lymph nodes. M stands for metastasis, when cancer spreads. What are the 4 stages of cancer? 1. Stage I. The cancer is localized to a small area and hasn't spread to lymph nodes or other tissues. 2. Stage II. The cancer has grown, but it hasn't spread. 3. Stage III. The cancer has grown larger and has possibly spread to lymph nodes or other tissues. 4. Stage IV. The cancer has spread to other organs or areas of your body. At the end, it is requested to you to please subscribe our channel.